I'm Dame Sally Davies. I'm the Master at Trinity College here in Cambridge, so welcome to the Master's study. And I was the former Chief Medical Officer of England. I'm delighted to be taking part in this year's HLTH conference and to be joined here today by David Feinberg, Vice President, Head of Google Health, and Dan Schumacher, President and COO of Optum. The three of us are here today representing multiple sectors to speak about the need, necessity actually, for cross-sector collaboration in responding to this pandemic and also preparing for the next one. Because we do know there will be another, the next one. The question is only when. Time is extremely precious. And as the impacts of COVID-19 continue to traverse the world, we have choices to make. Do we simply respond to the here and now, or do we work to prepare for the long term? We argue we have a responsibility to turn this health emergency into an opportunity, which is why we, from Optum, Google, and Cambridge University, along with 19 other founding members, have come together to create the Trinity Challenge. Our founding members come from all sectors. We are united by the belief that humanity does have the means to ensure that health emergencies like COVID-19, disrupting and destroying lives and livelihoods everywhere, will never happen again like this. So the first step is to understand that the solutions we need could come from anywhere and anyone. You know, preparedness requires the best minds across a range of disciplines and sectors. Our economists, our behavioral and molecular scientists, our data experts. These and others are all critical players in the promotion and protection of our global public health. And that is why the Trinity Challenge is now open from today to applications from all to provide solutions to health emergencies across three areas of focus. Identification, for instance, what if we had an early warning system that could identify pathogens before they caused great harm? Response, what if we knew which targeted intervention was most effective in a response? And how could we ensure that this is adopted at minimal cost? And the third area is recovery. For instance, these are only examples. What if we knew how to initiate a social and economic recovery in a way that did not exacerbate inequalities? We are so excited to have launched this challenge. We urge all of you who are taking part in this conference and beyond to take action and register your interest in participating in the challenge. With your help and in partnership with all our members, we really believe we have the chance to really change how well we prepare, we respond, and we recover with health emergencies. So, enough from me. Let's hear from Dan and David. So, I'm going to ask you both in turn, and I'll start with David. I'm delighted we can all work together on the Trinity Challenge, but let me ask you, what excites you most about having joined the Trinity Challenge as a founding member?
Well, Sally, it's really a pleasure to be with you and to spend time with you and Dan. What excites me most is that Google, I would say, has been thinking about these types of things for a while, and we believe it's our responsibility to think about these things going forward. Let me give you some examples. So you brought up the three areas to identify how we respond and how we recover. And just talking about what we're dealing with right now around identification. So in partnership with Apple, I'm really proud of our exposure notification. That's a tool that can be very, very helpful in contact tracing. And you can imagine how that could be helpful in future pandemics. Already being used in the UK, South Africa, Brazil, Canada, Germany, Japan, US. It's a small piece, but it's an important piece in a privacy-preserving way to allow people to know, hey, you've been in contact with someone on the bus, that you wouldn't get that kind of information if they're not a family member or somebody in normal kind of contact tracing. We've also launched an epidemiologic toolkit that allows people to take information and try to predict what's coming next when we talk about identifying, and also just recently launched 420 search trends. So are certain locations looking up, again, privacy preserving, but are people saying, I can't smell or I have a cough? And does that show us those trends show that COVID could happen next in this location? This was based on work on the flu previously, so it's again using information to help identify things. But then we have to respond. And in response for us, it's really about authoritative information, getting people the right information at the right time. So we launched for COVID, the first time Google launched an SOS page, a separate page. We had done it before for non-medical conditions. This was our first medical. To let people know, here's authoritative information. There are no ads. It's curated. It's part, WHO, local, CDC, whatever it made sense for that location so people could get the right information. On YouTube, we had 300 billion impressions of our COVID information page. So we feel a huge responsibility to make sure with that kind of worldwide attention to our information that it's actually being provided by trusted and authoritative sources. And then is it working, with those responses? So we told communities that they should lock down. Are they locking down? So we have community mobility reports that show, are people going to the park? Are they going to work? So that governments and public health agencies can respond appropriately. And then finally, around recovery, which I think is so crucial. As a clinician myself, we've long known that there's inequities in healthcare, and this just brought it out to the rest of the world. So we've really focused on, as we go into recovery for this, how can we really battle the racism and the inequity that's been in healthcare for way too long. And that's again through partnerships, and that's been grants through Google.org. Very proud of our partnership with Morehouse School of Medicine, historically Black college and university, so we can get a better understanding of this information so that we don't repeat these health inequities going forward. So that's why we're so excited to be part of this challenge.
Fantastic, and those are wonderful stories. I'm particularly excited about the inequalities because my own subject was sickle cell disease. I had a clinic of 600 in North London before I moved into policy. But let me turn to Dan. What excites you about joining?
Absolutely. Well, thank you, Sally, and thank you to Trinity for the invitation to participate as a founding member. We're very excited to be joining because, we have a broad recognition that healthcare is very complicated, and that complication is compounded by fragmentation and lack of connectivity and lack of coordination. And so, that really centers us on the reality that no one organization can do it alone. And it's only really through collaboration with others that we're going to better prepare the world for future health emergencies. And, I think when you draw together and pool the resources, whether you're talking about some of the best minds across the globe, as well as technology and data, I think we're going to be in a far better position to be able to identify, respond, and recover. And at Optum, we look forward to lending our vast assets to that pursuit. We certainly have deep, rich, broad, well-researched data sources that we can lend to the effort, and we complement that with literally more than 100,000 clinicians, data scientists. We're very excited about that, and we feel a strong sense of urgency, as you expressed, and likewise David did, around really getting after health inequities. Obviously, this pandemic has had disproportionate impact on minority and vulnerable communities, and a foundational belief at Optum is that everyone should have equal opportunity to live their best life from a health perspective. And so those are the reasons that really excite us about being a founding member, and we look forward to collaborating with other private institutions, public institutions, and academic to be able to better prepare the world.
No idea how exciting it is for me. I've been in the public sector first as a doctor, then running research for the National Health Service and Chief Medical Officer. To hear you two today, but other founding members talk about the advantages of collaboration and how you will work with academia, the best minds in academia with the best minds in the private sector, plus the data, we have to be able to do something different, something better. And it's never been tried before, this sort of coalition and collaboration. Fantastic. So, David, I'm really curious what's on your mind about this pandemic that the world is living through. You know, what are you personally worrying at and thinking about at the moment?
Well, I think I'd break that into three things that I'm worried about. One is to make sure we get it right at work, that we get that authoritative information out, that Google continues to be seen as helpful and trustworthy, that we don't mess up, that we continue to lean in on, a privacy first approach. I've been at Google now a year and 9 months, and I'm positive that our technology can save lives. Positive. What I know is required is that we have trust. If we don't have trust, it's a complete waste. So that's on my mind from work, is establishing that trust over and over. And then as a more personally, professionally, as a child and adolescent psychiatrist, I'm petrified about what's happening to our children right now. So children and young teens and young adults need to socialize. Their job, especially the little ones, is to play. And it's to learn how to play with others. And that's not happening in a normal way. The other thing is that many of those little ones are potentially in situations where parents are stressed out because of work, because of social isolation, because they're sick. And they're vulnerable, those kids. Typically they get picked up because the soccer coach says, wow, this kid looked like they had a bruise, or the pediatrician or the school teacher. They're not having those contacts. So I'm really worried about them. And the young college age students, it's a very, very difficult time to be 18 to 24 right now, because everything is not designed the way that they should be interacting. And then, to be quite frank, Sally, I'm worried about my parents. So I'm worried about my family. So we have a 84-year-old dad and a 78-year-old mom who are really active and play golf and have fun, but we can't see them. And they came up for a kind of a reunion with my two brothers, and it was like a military exercise about COVID testing and masks and where do mom and dad eat dinner on the porch and all that stuff. And we lived through one, and now we're talking about, as the holidays are coming, are we going to do it again? Do we skip it? So, from a personal standpoint, hey, I'm super blessed. I got a great job. I can work at home. I'm not sick. But I got family stuff that I keep thinking about, and how do we kind of navigate through that?
Thank you for sharing that. I think we all share that about families and very close friends that we have to protect, and how do we do that? Interestingly, I, of course, with 1,000 residential students, we are facing this issue of how do you bring them back in? They've all arrived, but you can't do the things you normally do. So the most moving thing that I've had so far was in our great court, having 130 students socially spaced, distanced on the lawn, singing Danny Boy together.
Nice.
So there are very special moments. Dan, what about you? How have the last 9 months been for you and your role?
Well, certainly on a personal front, as David mentioned and well articulated, share some of those very same concerns. As it relates to the role, it has, like everybody, been a very dynamic time. And, the demands of the role have evolved as the pandemic has evolved. So, as you think about kind of the very early days, our first focus and primary focus was really on the safety of our employees. And most notably, the 100,000 clinicians that we have on the front lines of care, and how do we help keep them safe? And that sort of pivoted then to the supply chain. How do we make sure that they have personal protective equipment? But then it broadened out to, okay, how many beds are available? How much ICU capacity? How much ventilator availability? And then starting to pivot into what does our surveillance network tell us about how the disease is progressing, and how do we put together forecasting models that allow us to be able to provide insight to ourselves as we prepare, as well as to other healthcare organizations as they're working to prepare for what's coming towards them. Clearly the move to virtual was a rapid move, right? We had a whole bunch of people that have, COVID concerns, but then even well beyond that, the normal healthcare concerns, and a lot of that stopped as we stepped into the middle of March. And so we needed to get into a virtual world so that we could be connecting with patients. And if you look at the beginning of the year, we had about 1,000 physicians, a little less than that were actually providing virtual care. And that rapidly, over about 45 days, went to 15,000 physicians. And now we've completed nearly 1 million virtual visits. So making sure that people get necessary care along the way. And then throughout, we've been working on making sure that, to our earlier conversation about inequities and how do we make sure that we help the hardest hit communities. And so, we picked some initial communities to set up rapid testing sites for them in Philadelphia, as an example, or New Orleans, or Los Angeles, as places to provide education, rapid testing, so that we can start to help to address some of the health inequities. So dynamic times for sure. It's been evolving. It'll continue to evolve, but those are some of the things over the course of the last 9 months.
So fascinating, because what we still don't know is how best to get people to accept the social mandate of distance, masks, and hand washing, nor do we really know the best out of hospital care. And so through the challenge, we'll be able to work with each other and learn from each other, I hope, and come up with some answers. There's also going to be some very interesting answers, aren't there, about why is Africa so varied? South Africa very impacted, and yet Ghana, Zimbabwe, places much less as yet. Fascinating. So I've known Sir Andrew Whitty, who is on leave from Optum, for some years when he was CEO at GSK and things. And we're delighted he's supporting the ACT Accelerator for the world. But one of the things he always talked about was the importance of partnerships and their power. And so we wouldn't be here without that belief between all of us and the other 19 partners. But can you share how Optum's partnered in this crisis and beyond?
Sure, absolutely. Well, we miss Andrew. We're sure happy that he's off doing what he's doing, and we look forward to welcoming him back in the hopefully not too distant future. But in any event, you said it well, a foundational belief in our company is really around partnership. And you see it in how we engage in the healthcare system today. We've got, we engage with 9 out of 10 U.S. hospitals. We support 4 out of 5 health plans in the United States. We work with 80 plus life science companies. So we have a really broad foundation of partnership to begin with. But as you said, there have been some new and unique partnerships that have been forged through the pandemic. First and foremost was our partnership with Health and Human Services. As Congress provided $100 billion of relief to providers as part of the CARES Act funding, we helped to distribute that and make sure that we got it into providers' hands as quickly as possible. We partnered with Boston Scientific, Medtronic, and the University of Minnesota to help build 3,000 light ventilators. We contributed to Mayo as an example, as they are studying the impacts of convalescent plasma in the treatment of COVID-19. We partnered with Microsoft, creating ProtectWell, helping organizations return to operations, how to do that safely. We also partnered with Morehouse School of Medicine, trying to study the impacts of sickle cell trait, which is more prevalent in the African-American community, and its intersection with COVID-19. And then, throughout our partnerships that we already had, we deepened and broadened them. For example, John Muir Health in Northern California, we've got a comprehensive relationship with them, and we were able to provide learnings and insights and share that 2 ways to make sure that they were in a position to be able to be ready and responsive as the pandemic made its way to them. So those are some of the examples. Certainly, partnership is very foundational to us, and it's one of the reasons we're looking forward to this collaboration and what we can learn from each other as we bring our unique insights to it.
So when the story of this pandemic is told, I think one of the very strong stories is going to be the role the private sector has played and the things that you're all doing. I'm going to come in a second to you, David, but people don't hear about these great stories of what you're doing and how this is saving lives. And I think it's a very special part. So David, why not share with us some of your partnerships in this crisis and beyond that have really been helping people?
Yeah, so let me echo what Dan said. I think healthcare is just way too complicated to do it alone. And Google, in its DNA, is a partnership company. When you think about taking information and organizing it, it's not oftentimes our information. So we have partnerships with, well, in particular in this one, we have a partnership with Apple, feeling that the Android phone and the Apple phone, cover a lot of people around the world. And if we had contact tracing, but you didn't know because your, coworker or family member was on a different platform, it wouldn't make sense. So that's been an important partnership. Partnership with the NHS, which has been really powerful for us to really kind of understand what's happening and to provide data and resources. Partnership with Mayo Clinic, partnership with CDC, WHO, I think we have partnerships with, if you go to Maps, I think there's 14,000 maps that you could look at to see, are they doing COVID testing, right? So partnership with small business, partnership to make sure that small private practice clinicians can do telemedicine. So Google is a partnership company. Healthcare is really, really complicated. We're certain that we can't do this one alone. So I just want to echo a lot of what Dan said. It's just really important to put down some of the competition when the real competition to me is depression, COVID, obesity, cancer, right? That's who we're fighting. We're not fighting the other tech companies in this space of health. So we look forward, and that's why this was such a great opportunity to join what you've created, because it's foundationally a partnership model.
Well, it really is. You may know this, David, but Dan won't know it as much because he came on board just a bit later. We started with a vision of collaboration, but the idea we needed a really big prize, and we were persuaded to change to lots more small prizes, because actually what the world needs is the collaborations and the global public goods. So I think it's very interesting that we are, I hate the word co-creating, but we're shaping this all together as a group of academics and private sector who want to show that we can do better next time and that we should never be in this position. So if we think about it that way, clearly some of this could be about logistics and systems and how you make it work. But one of the other things we're interested in, and the key question for the Trinity Challenge, is thinking about how do we best capture the power of advanced analytics and big data to protect billions against health emergencies and improve the health of the public across the globe. So what would you say are the ways we can harness data for preparedness, response and recovery? Which of you would like to go first? Why don't you, Dan?
Sure. Thank you, Sally. Our hope is that through the Trinity Challenge, it's going to yield some solutions in a couple of really important areas. One would certainly be an integrated data network. Right? To the opening comments about fragmentation and coordination and connectivity and some of the things like healthcare, having an integrated data network, particularly through to the supply chain, so that we understand what resources we have available where and when, I think is really critical, and hoping that we can formulate a solution around that. Second would be a surveillance platform. So a signaling platform for us to be able to see what's happening in real time and in a predictive way. So we move from reactive to predictive and really leverage that surveillance network. The third would be a playbook, right? So what's a roadmap for this? So we understand what this journey might look like. As we look downfield, we know where we need to be going. And lastly, from our perspective, having a forum, an industry forum, private and public partnership to come together rapidly. We're going to forge new relationships and connections that didn't exist before. And so the opportunity to pull people together really quickly and have an outlet for sharing, I think, will be really critical as well. So those are some of the things I really think about as being hopefully solutions that yield from the challenge.
I hope we do. And before I turn to David, I should reassure listeners that this isn't just about rich countries. This is about global public goods to help everyone, the low-income countries, the middle-income countries, as well as the rich countries. And we've all signed up to that set of values. But David, what do you think are the ways we can harness data?
I think Dan, gave a great list of what they are, so I don't want to repeat those. Let me add one that I think is really an opportunity right now that we shouldn't miss. The world now knows things like bend the curve. The world's starting to understand how important public health is, access to good food, access to clean water, and how those things then are potentially, problematic in these types of global pandemics. So I think we need to capture the world's attention right now and really lean into public health and health disparities. We need to use this as a calling to make sure that the next round, the disproportionate effects are not like what we're seeing this time. So to me, it's this silver lining because we've captured the world's attention. If we can now move to action, to giving everyone a chance of having a more healthy, equitable life.
That's rather a lovely one, isn't it? Yes, so address public health in its broadest, the structural issues as well. Yes. Okay, so it's going to need some globe-spanning data, isn't it? And that, I think, will be very interesting to challenge how we bring it together, identifying and locating emerging risks and analysing which interventions are effective in which. And I think what's very important about us all coming together, we've been thinking about where is the important data. And our premise is it isn't all in governments. In fact, most of it sits in the private sector. So we do have to all come together and we've got to work across these geographies and sectors. But we're going to have a block unless we can sort out greater data access. And so we're all working with the laws and norms of our own countries, but they can be a hurdle to that accessibility. So we're going to have to think how to make it friction-free, but privacy preserving and trusted to allow the insight. And for those who decide they want to join in, and we hope lots of you will, there will be privileged access into the data, and you bring out the insight. And we can have enormous breakthroughs using artificial intelligence and machine learning, which you both will understand better than me. But I think how do we work together to build trust about data and have those open conversations on privacy, confidentiality, and the trade-offs are going to be very important as we go forward over the cycle each year of a new public challenge and the work that we've started between the members. So how do we do that to lead to boundary-spanning insights? So let me ask you two about where you really want us to be. If I'm right, we'll have another outbreak in 5 years' time or before. So when that next outbreak happens, what will we be doing differently because of the Trinity challenge? David.
Well, I'm happy to answer the question, but I want to end that question with a question for you, Sally. So I hope that I'm actually pretty certain, I'm optimistic that this coming together will allow us the next time to be quicker in identifying what's happening, to have a more thoughtful and effective response, and that it will mean that recovery will be much easier. I just think we will be building the foundations to be better prepared for what's coming next. But my question for you, Sally, is that, maybe it was about 4 or 5 weeks ago, you spoke at Google with Karen DeSalvo, our Chief Medical Officer, in our Google Clinical Speaker Series. And you, first of all, you're super funny, and I love the talk. You've been a pioneer for women in medicine, and it was inspirational to listen to you. How has it been for you to carry the torch during this pandemic in your current role?
So interestingly, I think I've been carrying a torch a lot of my professional life. First, specializing in sickle cell disease, which very few people did at that time in this country. Then setting up the National Institute of Health Research in Britain with £1.5 billion a year to spend on clinical and applied and policy research. Then, as the first woman chief medical officer in 165 years, and now as the first woman master here, and we were established in 1546 by King Henry VI. So I don't know that it feels different, but I do worry. So you and all of us are worrying about mental health issues. I'm also worrying about the increased violence against women during the lockdown and this time. I'm worrying that the evidence is there that women are spending more time on childcare than their partners, and therefore they have less time for their own career and for their own lives, and there's less space. I think that this is not only hitting inequalities socially, but it's hitting the gender inequalities in a big way. And so I worry about that. And I think part of my role has always been to give voice to the problems that I see and hear. And so, of course, we are here to talk about the problem that we could and should do better when there's another pandemic, and that we as the Trinity Challenge are coming together to do that. I'm thrilled that you're both partners in this and that we have the other great founding partners. I want to thank you for sharing your views today. Let me, on behalf of all of us, remind everyone that if you apply and you join a challenge team or submit the answers without even joining a challenge team, you can get a prize of 10 million sterling pounds. But if you register your interest, you can collaborate with founding members and other members and have access with privileged access agreements to the data that they hold. So from Microsoft to Imperial College, Facebook to Optum, Google to Tencent, we've got endless possibilities. We want innovative ideas and approaches and solutions that really answer critical questions about preparedness, response and recovery. So please, on behalf of all of us today and those who aren't online today, please register your interest online for joining us in trying to be better prepared next time. Look at the trinitychallenge.org and apply. And we've got lots more information on that website. We're really excited about working together in teams, collaborating, academia, private sector, private to get innovative solutions that can help the world. So join us. Thank you for your time. Dan, David, great pleasure to get to know you better. And I look forward to all our future working together as a true collaboration of equals and partners. Thank you.
Thank you, Sally. Thanks, Dan.
Thank you, Sally. Thank you, David.